We are going to discuss about atherosclerosis. What is sclerosis? Sclerosis. Yeah, very good. It is scarring. Sclerosis is formation of fibrous tissue. Athero stands for blood vessel. Okay. That's why some people they use artery also because it is commonly in artery. So atherosclerosis is the formation of scar tissue. And atheromatous plaque. Plaque means a raised structure. Raised structure. Atheromatous plaque means it is the plaque which is formed by atherosclerosis. Consists of a raised lesion. Okay, plaque in simple words it is a raised lesion. But at traces it differs depending on the composition. In atherosclerosis it is soft, yellow, core of lipid. Core means? What do you mean by core? Core means inside, deep. The center part of any lesion is the core.
Doesn't mean the marrow.
Yeah?
Doesn't mean the marrow in general language.
Marrow?
Yeah.
Marrow.
Marrow, yeah.
Marrow is, it is used in bone. Okay? Core of lipid. Mainly cholesterol and cholesterol esters covered by a white fibrous cap. This is the diagram of atherosclerosis. This, I think you have seen this at many places. This is the core. The center, it consists of cell debris, cholesterol crystals, foam cells and calcium. Foam cells is? With cholesterol, lipid laden macrophage. Any macrophage it engulfs lipid, or you can use cholesterol also because cholesterol is also a lipid. So lipid laden macrophage is called foam cells.
Lipid what?
Lipid laden means engulf. This is the term which is used in medical books. That's why you should remember like this one. Lipid laden macrophage. Lipid laden macrophage means a macrophage which engulfs lipids or which engulfs cholesterol. And the covering tissue consists of smooth muscle cells, again macrophages, lymphocytes, collagen, elastin, proteoglycans. All this is present here. Okay?
Doctor?
Yes?
Blue line, which is constriction.
This is blood vessels.
It's not the...
This one is endothelium. This is a diagram, it is not a...
blue line in the below.
Yeah, what is this blue line?
It's the true or the healthy position.
This one?
Yeah.
Yeah.
No, above.
This one?
Yes.
What is this? No, endothelial cell is this. Single layer. You know the layers of artery?
Yes.
Tunica intima, tunica media, tunica externa. So tunica media and tunica intima is separated by elastic. This is elastic line. Okay, this is the tunica media. The whole thing is tunica media only. Okay? Okay, risk factors. The risk factors means any factors which cause the disease. That is called risk factors. So we will classify this risk factor into two. It is non-modifiable and modifiable. Non-modifiable means you can't change.
You cannot.
Like increasing age. Any person whose age is increasing, you can't stop his age. Okay? Male gender. It is impossible.
No.
A male can become...
Nowadays you can.
Nowadays you can. But that is not a complete female. See, natural male is different and an artificial male or female is different. Okay? Male gender, family history, and genetic abnormalities. These factors are modifiable. This you can stop or delay, like hyperlipidemia, hypertension, cigarette smoking, diabetes, C-reactive protein. All these are.
This
Obesity is also. It is also modifiable.
And the emerging.
Obesity, because hyperlipidemia is there indirectly, it comes under that only. Not directly, it is indirectly.
Actually, there is another criteria which is called emerging.
Emerging.
Yeah.
So whatever it is there, you can write any risk factors which is present. Okay?
Because obesity takes too long time to develop this disease.
Yeah. Okay? Among this, hyperlipidemia, hypertension are the most common cause. So hyperlipidemia, I think biochemistry people, they have already discussed. LDL, VLDL, HDL. Among this, LDL is low density lipoprotein, which is also called bad cholesterol. Why it is called bad cholesterol? Yeah. So low density cholesterol, LDL, is a bad cholesterol because it is delivered to peripheral tissue and is associated with increased risk. And the opposite is for HDL, high density lipoprotein, mobilizes cholesterol from tissue and transport it to liver. Okay? Whenever the lipid is circulating, definitely it will affect the vessel wall. Okay? So high levels of HDL correlate with reduced risk. So it is not that if you are getting a high total lipids is very high, for example, triglyceride. So more important is not the more important is you have to check the individual level, because usually this is a common test which is done, lipid profile. So in that you have to check the LDL and HDL. Sometimes they will give you LDL HDL ratio also. Okay? So in that if LDL is high, yeah,
that one is the important.
Yeah. Ratio is important. So if LDL is high and HDL is low, means that is increased risk. If HDL is high, LDL is low, that means it is protective. Hypertension is the most important cause of left ventricular hypertrophy. Okay. Cigarette smoking, diabetes. So these are the few risk factors we have discussed. Now the pathogenesis.
C-reactive protein. What's that?
C-reactive protein, it is just and it is increased in inflammatory conditions.
Yeah, I know that, but
no, those details are not there. Just remember the names. That's all. Okay. Now comes the pathogenesis. Before starting the pathogenesis, do you remember POD block? We have discussed embolism and thrombosis. What happens in thrombosis? Yeah.
Firstly, thrombosis, then the attachment and
thrombosis. First there will be injury to the endothelial cell. After that, platelet adhesion, leukocyte aggregation, then platelet aggregation. So all this is nothing but the same. The pathogenesis is same for atherosclerosis also. So first thing you will see endothelial injury, which causes increased vascular permeability, leukocyte adhesion and thrombosis. After that, accumulation of lipoprotein, the core of the atheromatous plaque, we have discussed that. That is the lipoprotein, and mainly it is LDL. After that, monocyte adhesion to endothelium, followed by migration into intima and transformation into macrophages and foam cells. Platelet adhesion, factor release from activated platelets, smooth muscle proliferation, and accumulation of lipid. Yes?
So doctor, the endothelial injury is not caused by cholesterol. Cholesterol will act after the injury.
It is both. Sometimes cholesterol also will cause injury. Just like smoking will also cause injury. That's why we are taking that in risk factors. Okay? So, but because in pathogenesis, each thing, if we want to explain, we can explain, but this is usually a sequence. Endothelial injury, after that, accumulation of the cells, accumulation of lipids, after that platelet monocyte adhesion. Once monocyte enter the injured area, it will become a macrophage.
Actually, the endothelial injury, it may be caused by the cholesterol.
Yeah. But for example, if there is hypertension, it may cause maybe cholesterol, yeah?
Or diabetes,
Yeah.
because there's thinning and weak.
Yes, you are right. Okay? Is the pathogenesis clear? Any doubt in this?
So it will become foam cells, monocytes.
Monocyte, yeah, monocyte will be in circulation. Once it enters the injured site, it becomes a macrophage. And the function of macrophage is to engulf. Okay? That's why nowadays atherosclerosis comes under chronic inflammation. They are saying because all this is an inflammatory process. We have discussed in chronic inflammation also. The inflammatory cells after 48 hours, the neutrophils is replaced by lymphocytes and monocytes. So this is nothing but the chronic inflammation only. This is the diagrammatic representation of the same thing. Okay? Chronic endothelial injury, the causes are hyperlipidemia, hypertension, smoking. All this is the cause for chronic endothelial injury, which leads to endothelial dysfunction and macrophage and smooth muscle cells engulf it, platelet adhesion, smooth muscle proliferation. All this is the diagrammatic representation of this pathogenesis. Pathogenesis is very important. You should remember this. All these steps: endothelial injury, accumulation of lipids, monocyte adhesion, platelet adhesion, factor release. Again the same, endothelial injury. See, there are two things. One is endothelial injury means endothelium itself is getting removed. Second thing is endothelial injury in other terms means is endothelium is there but it is not functioning properly. What is the function of endothelium? To release pro-thrombotic factors and decrease the anti-thrombotic activity. This is the function of endothelium. This I think we have already discussed in thrombosis. So if this function, this activity is not there in the endothelium, the cell will be there but it is not functioning properly, that also will come under endothelial injury only. Okay? So dysfunction, that's why it is called dysfunctional endothelial cell. Show increased endothelial permeability, enhanced leukocyte adhesion and altered gene expression. Second thing is the hemodynamic disturbances, disturbed flow patterns. Like, what do you mean by hemodynamic disturbances?
Maybe a decrease in blood.
Decrease in blood flow. Like in polycythemia vera, there is hyperviscosity.
And decrease.
Yes? Yes?
And there is decrease in the.
Any doubt? Yeah?
What does endothelial cells secrete?
Anti-prothrombotic factors and anti-thrombotic prothrombotic factors. It increase the prothrombotic, decrease the prothrombotic activity and increase the anti-thrombotic. Just remember prothrombotic and anti-thrombotic, that's all. Because thrombosis is not there. Your objective is only this one.
Prothrombotic, yeah.
Antithrombotic. It decreases the prothrombotic factors and increase the antithrombotic factors. Disturbed flow patterns, it means that whenever there is, for example, if circulation is there, the blood is not flowing properly in the circulation. Like in polycythemia vera, the blood is viscous, hyperviscosity. Okay, one is this. Second thing is if there is aneurysm, the flow will be disrupted. It will not be a regular flow. So all this will injure the endothelium. Again, it will injure the endothelium and cause this atherosclerosis. Okay, that's why it is called disturbed flow patterns. Stasis is also a type of disturbed flow pattern.
Atherosclerosis can cause aneurysm, right?
Which one?
Atherosclerosis.
Yeah, atherosclerosis itself can cause aneurysm. Sometimes, if there is aneurysm without atherosclerosis, just beginning,
No,
so
different
that
types.
aneurysm itself will cause again atherosclerosis.
Yeah, but there's different types, like true.
True aneurysm,
It's
false
caused by-
aneurysm, dissecting aneurysm, yeah. I think we have discussed this, aneurysm. No? Okay. Lipids, again increase LDL cholesterol, decrease HDL cholesterol, and increase abnormal lipoprotein. Inflammation, all this is the mechanism how this atherosclerosis is occurring. Inflammatory cells and pathways contribute to initiation, progression and complication of atherosclerotic. That means inflammation, it will initiate the process, it will propagate the process, and as well as it will complicate the process. All this thing is caused by inflammation. Infection, again same, it will cause local inflammatory process. Whenever there is infection, there is always inflammation. So any infection inside the blood vessel, it will lead to inflammation and itself will cause atherosclerosis. And last is the smooth muscle proliferation.
So, doctor, any one of them can start the pathogen?
Yeah, you can start the pathogens mechanisms. This is just for your knowledge how this, because this we have already discussed in the POD block also, how this monocyte adhesion occurs, then immigration into the intima, and how the macrophage, it will engulf the lipids to form the foam cells. This is extracellular matrix which contains smooth muscle cell and contains proliferation of smooth muscle cells. How the monocytes will come to the place?
Chemotherapy.
Any idea? Yeah.
Immigration.
By squeezing.
Because of which one?
Squeezing.
Yeah, it is squeezing and everything. For example, there is
Chemotherapy
injury
factor.
here and monocyte is circulating. And once it is attached to the injured part,
Chemotactic factor.
yeah, what is that chemotactic factor?
Interleukin. It's
Uh,
something
alpha
plus
A.
interleukin.
Yes, very good. It is cytokines, mainly interleukin 1. It is, yeah. Whatever it is interleukin, because of this interleukin, it will, see this. These are the cytokines. Interleukin 1, mainly it is interleukin 1, because of that, it will be attracted to that place. Okay. Till this, all the basics are there. That means what is atherosclerosis, what is the pathogenesis, and what are the risk factors, everything. From here, the main pathology starts. Okay? Morphology. What do you mean by morphology? Morphology contains gross and microscopy. The gross appearance, first it will start with fatty streaks. Fatty streaks means, what do you mean by streaks? Lines. Yeah. In other terms, it is lines. So fatty lines. So it will be yellowish or sometimes whitish. Fatty streaks composed of lipid-filled foamy macrophages, beginning as multiple minute flat yellow spots. Multiple minute flat yellow spots. Okay? They eventually coalesce into elongated streaks, 1 centimeter or more in length. These lesions are not significantly raised and do not cause any flow disturbance. So this is the first thing.
What does it mean of minute?
Minute? Minute means it is not minute, it is minute, very small. This is not minute, it is minute. Okay. Minute means very small. So to start with, it will be very small. And what are these small minute dots? These are all lipid-laden macrophages, or other words, it is foam cells. Okay. So atherosclerosis, it starts with fatty streaks. After that, these fatty streaks, they coalesce. Coalesce means they join together. Coalesce means they get attached to each other and forms a fatty streak. First, it will be minute yellow spots. Then they all join to form a fatty streak, and these fatty streaks, they are not raised. After that, what will happen? This process starts, the process of chronic inflammation, okay, the proliferation of smooth muscles. Then these streaks, they get raised into the blood vessel. So atherosclerotic plaque have 3 principal components. One is cell, second is ECM, and intracellular and extracellular lipid. Cells, what are the cells which are present? It is, one is smooth muscle cell, second is macrophages, and third is lymphocyte. Okay? Macrophage and lymphocytes, it is, yes?
The fatty streak compared to the atherosclerotic.
Yeah. It will start with fatty streaks, and after that it will develop into atherosclerotic plaque. Fatty streak is not raised, but once atherosclerotic plaque comes, means it is a raised lesion inside the blood vessel. So cells, smooth muscle cell, macrophages and lymphocytes. Extracellular matrix contains collagen, elastin fibers and proteoglycans. And intracellular and extracellular lipid is the third thing. So whenever atherosclerotic plaque comes, because usually it will come in your OSPI. Okay, so you have to mention these things. The components of atherosclerotic plaque are cells, ECM, and lipid. Cells, smooth muscle cell, macrophage, lymphocytes. ECM, in extracellular matrix you will see collagen, elastin, proteoglycan. And third is the lipid. It is both extracellular as well as intracellular. Extracellular means outside the cell, intracellular means inside the macrophages. Is it clear? Atherosclerotic plaque. So this is the description, and the diagram usually, I think you have also seen in your previous years also, the diagram usually is given is this one. Okay? So if this diagram is given, the diagnosis is atherosclerotic plaque. You will be asked some risk factors, hypertension, smoking, whatever you
This
have
will
got.
come with those, like this.
Yeah, this will come in hospital. You want this in exam? As a CQ? The CQ also it can come, don't worry. Okay? But diagrams usually it is asked in hospital. In India, usually in our exams, in exam also they will get diagrams. I think this we should tell the dean to introduce this system also. We should start diagrams. See, if you draw the diagram, you will understand it better, always.
We have also.
Yeah, you have already auspic. Okay. So that is the diagram for atherosclerotic plaque. This is the description. Okay, cells, ECM and intracellular matrix. What is this?
Blood vessel.
These are all fatty streaks. Okay, and these holes, what you are seeing, what it is? These holes. All these holes are the branches from the blood vessels are arising from here, the arteries. This whole thing is the aorta. Aorta is cut longitudinally and opened. So you will see like this. Okay, all these are the holes. If you observe one thing, these arrows are all fatty streaks. You can see discoloration, that means compared to this it is different. So these are all fatty streaks, and these fatty streaks are present at the origin of the blood vessels. The origin of the blood vessel, it is called ostia. Ostia means opening. Ostia is the opening. This is the opening of the branching arteries. So wherever in aorta the branching arteries is there the blood flow will be somewhat disturbed. Not disturbed, it is somewhat a different type. So there it will start. So fatty streaks usually it is present at the ostia of or origin of the blood vessels or origin of the branches. And what is fatty streak? It is, what is fatty streak? Lipid laden macrophages or foam cells, you can say. So this is the microscopy which contains macrophage derived foam cells. These are all foam cells. Okay. So at this point there is not of any pathology, just you are seeing a discoloration. So there won't be any flow changes in fatty streaks. Mild atherosclerosis composed of fibrous plaque. Here it is not clear. Did you see in your laptops or mobiles? This is very clear actually. Okay, these are all atherosclerotic plaques, and here you are seeing severe disease with diffuse and complicated lesions. Okay. The difference between mild and severe is atherosclerotic plaque is mild plaque it will not have, it will be just raised without any complication. Whereas severe means what will happen? It will lead to complication. What are the complications of atherosclerosis? Yeah, thrombus, rupture and thrombus formation. Plaque rupture with superimposed thrombosis. This is atherosclerotic in a coronary artery. Fibrous cap is F and central necrotic largely liquid core C. Okay. This whole thing is the coronary blood vessel. Because coronary arteries, it is the most common place for atherosclerosis. This whole one is the coronary artery, and you can see the lumen is very much narrowed, and it is narrowed, and this all is the atherosclerotic plaque. Okay, this is the fibrous cap, and this is the lipid core. You just compare it with the first diagram. The lipid core will be in the center and surrounded by fibrous cap. Okay. Second thing, media of the artery is thin under the most advanced stage. See this. Media is thin because atherosclerotic process occurs usually in which layer?
Media.
Yeah, it will be in tunica media. So the tunica media will be the most commonly affected layer of the artery. Second thing, scattered inflammatory cells, calcification and neovascularization. What is this type of calcification? This one is the calcification where arrowhead is there. Atherosclerotic plaque is a dead tissue. Okay? So the calcification which is deposited, the calcium which is deposited in dead tissue is called which type of calcification? There are two types of calcification. You studied this in first year. Pathologic calcification and dystrophic calcification. Metastatic calcification and dystrophic calcification. Metastatic calcification is abnormality in calcium, but it is deposited in normal tissue. Dystrophic calcification is calcium is normal, but it is deposited in dead tissue. So atherosclerotic plaque, it is a dead tissue. So calcium which is deposited in this is dystrophic calcification. So you will see calcium deposit also. So scattered inflammatory cells, because it is a chronic inflammatory process, calcification and neovascularization. Whenever plaque rupture without superimposed thrombosis and thrombosis superimposed on an atherosclerotic plaque with focal disruption of fibrous plaque. This is a fibrous plaque, you can see here, and here it is disrupted. Whenever the fibrous cap is disrupted, what will happen? The content inside will come out, and this will again cause complication with thrombosis and thromboembolism. So this is a complication. So thrombosis superimposed on atherosclerotic plaque with focal disruption. Whenever there is disruption, all the contents will come out and it will form a thrombus and it will block the lumen. So here you compare this with this. There is no disruption here. Okay, plaque rupture without superimposed thrombus. There is no thrombus which blocks the lumen of the vessel. What is the clinical importance? Why we are concerned about atherosclerosis? Because of these complications. Okay? First one is the rupture, ulceration and erosion, which will induce thrombosis. Second is hemorrhage into the plaque. Okay? Rupture of overlying fibrous cap or of thin walled vessels in the areas of neovascularization can cause intraplaque hemorrhage. So there will be hemorrhage, that means small blood vessels inside the fibrous plaque. If they rupture, they will cause hemorrhage. Atheroembolism, this rupture, it will form an embolus, and that embolus can circulate in blood. Aneurysm formation.
Dilatation.
Yeah, dilatation. Why there is dilatation? Because of the weakness of the blood vessels. There is obstruction, blood vessel is weak, it will dilate. Atherosclerosis induced pressure or ischemic atrophy of the underlying media with loss of elastic tissue cause weakness resulting in aneurysm, dilatation. So these are the few clinical important changes: rupture and ulceration, hemorrhage, embolism and aneurysm. Consequences. What do you mean by consequences? Yeah, in other words, it is a complication. Okay, if atherosclerosis is there, what will happen? So there can be stenosis, there can be acute plaque change with rupture, fissuring, erosions, ulceration. What we have discussed, all these things. There can be thrombosis. There can be vasoconstriction. Okay, constriction and stenosis is the same. So there can be stenosis, there can be acute plaque change, there can be thrombosis as well as constriction. Again the same thing, the consequence aneurysm and rupture, occlusion by thrombus, critical stenosis. See, all these things you will see in preclinical phase. Preclinical phase means
Before symptoms.
Symptoms appear.
before symptoms and signs occur. That means the pathogenesis is started, but the patient is unaware of it.
Hidden.
Okay, it is hidden. So normal artery is there, then fatty streak. Fatty streak will lead to fibrofatty plaque and advanced vulnerable plaque. Okay, till this stage the patient is unaware most of the time. Okay, only few patients they will do their regular checkups to see whether anything is there inside the body. Otherwise, most of the people they don't go frequently to the hospital. Okay. So this is the clinical phase, usually middle age or elderly. What do you mean by mural thrombus?
Involving the layers.
Yeah,
of
like
the
the
layers
wall.
of the-
The wall.
Yeah, wall. Any thrombus which involves the layers of the blood vessel or the heart. Okay, that is called mural thrombus. Embolism, wall weakening. This will lead to aneurysm and rupture. Second thing we have just discussed, if there is hemorrhage, it will lead to occlusion, and sometimes there will be critical stenosis. That means the plaque, if it progresses, it will stenose the blood vessel. Thank you. Do you have any doubt?